So in this video, we're going to be looking at soft tissues and viscera of the chest, starting with breast tissue. So breast tissue is mainly fatty tissue and lactiferous glands. It may extend from the second to the seventh ribs, from the lateral border of the sternum to the anterior axillary wall near the armpit. So if we fade this region, we can kind of look at these ribs. Okay, so here's the second rib, third rib, fourth, fifth, sixth, seventh. So depending on the person, breast tissue may extend down to this seventh rib. And here's that second rib. Here's the lateral border of the sternum. And then here's the anterior axillary wall near the armpit. So that's kind of the borders of the breast tissue. Okay, and then on the breast itself, we have the nipple. The exact position of the nipple is variable, but it may be approximately near the fourth intercostal space, so right below the fourth rib. It's usually in line with the mid-clavicular line. So if you divide the clavicle in half, it's usually about halfway down that line. It could be a little bit more lateral. In this case, it does look a little bit lateral to that mid-clavicular line. And then there's the areola, and the areola is the more pigmented tissue around the nipple. This is looking at a biologically male breast. I'm going to show you another picture. Okay, so this is a more biologically female breast. It's divided into quadrants. And the next thing we have to notice is something that's called the axillary tail of the breast tissue that extends superiorly and laterally from the anterior chest wall into the axilla, or armpit. So this is really important to remember, is that the breast tissue actually extends up into the armpit. Okay, so that was breast tissue. Next, we're going to go down to the viscera. And we're going to start by looking at the lungs. So here are the lungs. Here's the left lung and the right lung, left and right on this person. If we take this skeletal structures off, we can see that there's this space between the lungs. And so this space between the lungs is called the mediastinum. And that's just the hollow space it's the central portion of the thoracic cavity between the lungs. It contains the heart, which lies transversely and slightly posteriorly, leaving the right half of the heart lower than the left. So let's go ahead and take a look at that. So here's how the heart is situated within the lungs. So now let's look a little more closely at the heart itself. So you can see that the heart lies somewhat transversely in the mediastinum, which means it doesn't look quite as up and down as we would expect it to. So the borders of the heart consists of the right atrium. So here's the lateral wall of the right atrium. So if this is the person, right, this is the right side of their heart. With the superior vena cava, here's the superior vena cava, entering the right atrium at the superior edge of the right border. The inferior border, starting on the right side, consists of the inferior vena cava and the right ventricle. So here are the walls, the pieces of the right ventricle. So this entire thing is the right ventricle of the heart. So this also comprises approximately 2/3 of the lower border, or the inferior border of the heart. And then moving around to the left side, we have the left ventricle. Okay, so here's the left ventricle on the left side of the heart. So looking from the front, that's where the left ventricle is. So the inferior 2/3 of the left border consists of the left ventricle. Okay, and then the left atrium. So here's the left atrium. Here's the posterior lateral wall of the left atrium. So this entire thing is the left atrium. and the pulmonary artery. So here's the pulmonary artery, comprise the superior portion of the left border. Here's what that looks like from the front. The left atrium, the pulmonary artery. The aorta, here are the parts of the aorta. So we have the aortic bulb, ascending aorta, and aortic arch. So the aorta lies in the midline. It's posterior to the sternum. And so in order to orient ourselves to where the heart is in relation to the ribs and skeleton, we can look at this illustration that should help with that. So the right border of the heart. So here's the right border of the heart. It goes from the 3rd to the 6th costal cartilages, right? So here are the ribs, and then in from the ribs are the costal cartilages. So 3rd, 4th, 5th, and the beginning of the 6th, down to the 6th. It's 1 centimeter lateral to the right sternal margin. So the sternum's not shown here, but the sternum's going to be about right here. And it's going to go about 1 centimeter lateral to that. At the 6th costal cartilage, the inferior border goes level with the xiphosternal joint. So here, this little tab here is the xiphoid process. So here's going to be the xiphosternal joint. So it goes across the xiphosternal joint and continues to the left 5th intercostal space. Okay, so here's the 5th rib, and then just inferior to that is this 5th intercostal space, and it's actually labeled here. So it's going to go to the left 5th intercostal space in the midclavicular line. So here's the clavicle and approximately the midclavicular line. And at this position, if you palpate into this 5th intercostal space, you can actually oftentimes feel the heartbeat. It's called the apical beat, or it's also called the apical pulse, or the PMI, which is called the point of maximum impulse of the heart. The left border goes from that 5th intercostal space diagonally up to the left 2nd intercostal space. So here's the 2nd rib, and then here's the 2nd intercostal space. So it's going right up into that 2nd intercostal space. Also 1 centimeter lateral to the left sternal margin. So the sternum's going to be about right here, and it's about 1 centimeter lateral. The superior border then connects the left 2nd intercostal space with the right 3rd costal cartilage, and that's where we started, on the right side. So those are the skeletal borders of the heart. The aorta is located posteriorly to the manubrium. Okay, so here's the manubrium, and then here's the aorta, and to the sternal angle. So here's that sternal angle, so that's about level with where the aorta is first emerging from the heart. And then there are 2 other structures that are also posterior to the manubrium and the sternal angle at about that level. And so to show that, I'm going to take the skeleton off. So those structures are the trachea and then also the esophagus, which is right here. So at that level, if we follow that back from anterior to posterior, the structures are anteriorly the aorta, posterior to the aorta is the trachea, and then posterior to the trachea is the esophagus. At that level of the sternal angle, which is also level with posteriorly with the body of T4, the trachea divides into the right and the left bronchi, which then enters the lung. So there's the left bronchi entering the lung and the right bronchi entering the lung. At this point, the esophagus also curves anteriorly and will now be anterior to the aorta and the trachea. Put the aorta back, and we look from the posterior side. The order of these structures from anterior to posterior at the level of the sternal angle and the level of the body of T4. The order is now the esophagus, the bronchi, and then the aorta, which is most posterior. Immediately posterior to the manubrium and the sternal body is the thymus gland. And that's lymphatic tissue. That's part of the lymphatic system. And the thymus gland is anterior to all of the structures that we were just looking at. So the thymus gland goes from the superior border of the manubrium to the level of the fourth costal cartilage. Now, looking again just at the lungs are found on either side of the midline of the thoracic cavity. They have similar dimensions, but the left lung has a notch on the medial border. So here's that left lung, and here's that notch, and that's due to the location of the heart. So this is sort of where the heart is fitting into that left side. It's creating room for the heart. The apex of the lungs, meaning the superior border or the top of the lungs, is located 3 centimeters superior to the medial third of the clavicle. So if you divide the clavicle into thirds, here's about the medial third, here's the apex of the lung. If you go from the apex of the lungs inferiorly, just medial to the sternal margin, down the midline at the 6th costal cartilage. So here's the 6th rib, and then the 6th costal cartilage is going to travel up to about right here. On the right lung, then that's the anterior medial border of the lungs. And so here is that 6th costal cartilage helping to make that anterior medial border of the lungs. That's on the right side. On the left side, the lung curves away from the medial border at approximately the 4th costal cartilage. You can see that that's where that notch here is on the left side. So the inferior border of the lungs curves laterally, following along at the midclavicular line, the 6th rib. Here's that midclavicular line. Here's the 6th rib, and you can see that's the inferior border of the lungs. When you get to the mid-axillary line, the inferior border of the lungs is at approximately the 8th rib. The back, the inferior border is at approximately the 10th rib. To trace the posterior border of the lungs, you can follow the lateral borders of the vertebral bodies superiorly to the apices in the supraclavicular fossa. So you can see that this posterior border of the lung is following kind of near the transverse processes of the vertebral bodies back up to the apex, or plural is apices. And now the lungs are surrounded by a membrane, 2 membranes. They're collectively called the pleura. And the 2 membranes of the pleura make up the pleural cavity. That's a little bit tricky to see here, but it's this kind of greenish membrane. Oh, I'm selecting it right here. So the pleural cavity surrounds the lungs within 2 sides of the thoracic cavity. So the outside surface, or the outside pleura, is attached to the wall of the thoracic cavity and diaphragm, and it's called the parietal pleura. The inner lining that attaches to the lungs is called the visceral pleura. Inside the pleural cavity is a fluid called pleural fluid, and that helps to eliminate friction and rubbing between the parietal and visceral layers of pleura during respiration. So if we want to trace the borders of the pleural cavity, the medial and posterior borders approximately match the borders of the lungs as far as being along the lateral border of the sternum and the lateral borders of the vertebrae. But the lower border of the pleural cavity is approximately 2 ribs lower than where the lungs are. So at the midclavicular line, With the lungs, it was the 6th rib. With the pleura, it's the 8th rib. At the mid-axillary line, with the lungs, it was the 8th rib. With the pleura, it's at approximately the 10th rib. Posteriorly, with the ribs, it was the 10th rib for the lungs. For the pleura, it's at the 12th rib. If someone is breathing deeply, the lungs and pleura can extend more inferiorly. And then we're going to look once again at the diaphragm. We just talked about this, but we're going to look at a few other structures. So again, the right and left domes are separated by this central tendon, which is located at the level of the xiphisternal joint. Here's that xiphisternal joint. Again, the right dome of the diaphragm is higher than the left dome due to the placement of the liver. And then you have 3 openings in the diaphragm for structures that pass from the thoracic up here to the abdominal down here cavities. The first one is the venal caval hiatus, and that is for the passage of the vena cava. So the vena cava is this large vein that collects blood to travel to the heart. So here's the inferior vena cava, and here's that hiatus in the diaphragm for it to pass through. So it's for the vena cava, and it's called the venal caval hiatus. It's found approximately 1 centimeter to the right and approximately 1 to 2 centimeters superior to the xiphosternal joints. Here's that xiphosternal joint. And it's level with T8 posteriorly. So here's that 8th thoracic vertebra, and here is the venal caval hiatus, approximately level with that. The next hiatus is the esophageal hiatus, and that's for the esophagus to pass through. So let's take a look at that. It's a little more posteriorly. So we remove the skeletal layer, we can see that hiatus. So here's that hiatus right here for the esophagus to pass through. Okay, so here's that esophagus coming through the esophageal hiatus. And it's hard to see from here, but that esophageal hiatus is approximately level with the 6th costal cartilage. So here's where that cartilage would come across, that 6th costal cartilage. It's approximately 2 to 3 centimeters left of the midline of the body. And it is level posteriorly with the body of the 10th thoracic vertebra. You might be able to kind of see that. There's the hiatus right there, and there's that 10th thoracic vertebra. You have to kind of peek in to be able to see that. So there, both of those structures are. This is also the location of the lower esophageal sphincter. So the lower esophageal sphincter is a sphincter at the esophagus right before it travels through the esophageal hiatus and becomes the stomach. The lower esophageal sphincter, or the LES, prevents backflow of digesting foods and hydrochloric acid from the stomach back to the lower esophagus. If the integrity of the LES is compromised, that can lead to gastroesophageal reflux disease, or GERD. This is also the site of occasionally what's called a hiatal hernia, which is where the superior portion of the stomach pushes up through the hiatus in the diaphragm and into the thoracic cavity. That can also worsen acid reflux. And then finally, our third opening is called the aortic hiatus, and that's roughly in the midline of the abdomen. It's about 7 to 8 centimeters inferior to the xiphisternal joint. So here's that xiphisternal joint, and then this opening right here is the aortic hiatus. You can see that opening right here for the aorta to go through. It's also level with and immediately anterior to the vertebral body of T12. So here is T12 right behind it. And here is the aorta passing through. So that's the aortic hiatus. Okay, and that's it for soft tissues and viscera of the chest.